Today's topic on Best Care with Bestmed Medical Scheme is a breath of fresh air. We will discuss the management of asthma, and Dr. Coopoo is back to guide us through practical steps on how to make life easier for our little ones who have asthma. Welcome, Dr. Coopoo.
Thanks for having me.
Lovely to have you back. Before we start discussing the management of asthma, please explain to us, what is asthma?
All right, so asthma is a respiratory condition which affects the lungs. Basically, people with asthma have very sensitive airways, if I can describe it like that. So what happens is sometimes something will trigger their airways to get irritated. When that happens, the airways get tight, they become swollen and produce extra mucus. This will cause it to be difficult for your child to breathe.
Why should parents be concerned about asthma? What are the risks?
So asthma is a treatable condition. It can be well controlled and your child can live a normal life. But if asthma isn't well controlled, it can affect your child in a negative way. Their symptoms may cause them to miss school, which can cause them to underperform. It can cause them to have low energy, be tired all the time. It sometimes affects their mood, because you can imagine it can be quite sad to be able to not play with your friends. And in severe cases, you can have something called an asthma attack, which can be life-threatening.
Level with us, Doc, when it comes to babies and toddlers with asthma. What are the signs that parents can look out for?
So the main thing is shortness of breath. You see your child is struggling to breathe. They may make a whistling sound when they breathe. That's called wheezing. They may cough a lot. It's usually more at night or in the mornings. It's usually a dry cough. And the child, if they're old enough, may say that they're feeling like their chest is tight and something is squeezing their chest.
Any tips for our parents on how they can help managing their child's asthma at home?
So the first thing is to regularly attend your appointments with your healthcare provider. Make sure you are clued up on your child's medication plan. They call it an asthma action plan. So know what to do in case of an emergency, how to treat your child's asthma when they're well, how to treat your child's asthma when they're sick. Make sure that they take their medication every day as prescribed. The usual mainstay of treatment for asthma is asthma pumps. You have two types of pumps. You get a reliever pump, which is when your child is feeling sick or coughing a lot. They take that to relieve their symptoms. And you get a controller pump, which prevents their symptoms from happening and keeps it under control. That your child must take every day, whether they're sick or not. So just making sure you follow those steps can help your child.
That's quite interesting. Is there any tips that we can teach our children how to use nebulizers and inhalers correctly? And is there an age-appropriate technique for our little ones that you can help us with?
You as a parent need to make sure you are comfortable giving the treatment and know how to in order for you to teach your child. So don't be afraid to ask your healthcare provider exactly how to give the medication. It is quite complicated even for adults to take inhalers. What we do for kids is there's something called a spacer, and you attach it. It's a device that you attach to the inhaler, and it allows the child to take the asthma pump with ease. And I usually recommend children using a spacer until around age 7, until they're older. Little children will use a spacer with a face mask, so that will ensure that they can take their medication.
Do you have any practical tips for parents during an asthma attack when they are at home?
Okay, so it's important to keep your child calm, but most importantly, you need to keep calm because your child picks up on that. Make sure that your child is sitting up straight because that helps to open the chest and let them breathe easier. Make sure that you give them their reliever pump. So give it to them every 30 to 60 seconds, and you can give it up to 10 puffs and just monitor your child's symptoms. But you need to worry if your child's symptoms aren't getting better with the pumps, or they're struggling to talk, they are breathless, they may feel tired, drowsy, they may be looking a little bit blue around the lips. Those are serious signs, and you need to take your child to a healthcare facility immediately.
Thank you so much, Dr. Coopoo, for all your advice and tips. We appreciate it.
Only a pleasure.
With Bestmed, asthma is considered a chronic condition. This means that a member or dependent can register for asthma chronic medication, including the cover of various inhalers, tablets, and syrups. which will be covered by Bestmed every month, subject to authorization. Thank you so much, Bestmed Medical Scheme, for another episode of Best Care.